Case 2. Collapse and confusion. In a young woman history. A 32-year-old woman suffered a collapse while exercising at a gym. Her friends described the woman falling to the floor. This was followed by twitching of her arms and legs, and then a period of being unrousable. The woman remembered nothing following her arrival at the gym and was confused and drowsy for 10 minutes following the event. She has bitten her tongue but did not use consciousness. She has no past medical history of note, takes no regular or recreational drugs, and there is no family history of seizures. She has an extensive travel history, having backpacked around Asia and trekked through Nepal, where she stayed in hostels and ate street food 5 years ago. She describes being calm, completely fit, and well prior to the event. Examination. The woman is alert and fully orientated, and there are no significant findings on examination. An HIV test is negative. A CT head scan initially showed a cystic ring-enhancing lesion. 2 days later, an MRI head scan was performed. Questions. In view of the history and scans, what is the most likely diagnosis? This woman has presented with a generalized seizure. Having a first fit in adult life is unusual, so underlying pathology must be considered, such as a space-occupying lesion or a cerebral bleed, as well as metabolic disturbances. The CT scan showed a lesion in the left parietal lobe with a central focus and ring enhancement. The differential diagnosis of ring-enhancing cerebral lesions in patients with intact immune systems typically includes primary or secondary tumors and pyogenic abscesses. In immunocompromised patients, consider also toxoplasma infections, lymphoma, and cerebral tuberculosis. This patient's HIV test was negative and she had normal blood counts. The MRI scan shows the lesion in better detail, revealing the classic dot-in hole appearance that is associated with neurocysticercosis. This is the most common parasitic infection of the central nervous system and the leading cause of adult-onset seizures in the developing world. The infection has a complex cycle and begins with humans ingesting raw or undercooked pork from pigs infected with Taenia solium. These humans can develop tapeworm infections and shed embryonated eggs in their feces. In areas with poor hygiene facilities or where human waste is used as a fertilizer, these embryonated eggs can be ingested, leading to cysticercosis developing in all tissues, particularly in the brain, eyes, and subcutaneous tissue. This patient should receive anti-helminth medication. Most patients will remain free of seizures once the underlying structural lesions are broken down. This may take some time following anti-helminth medication, and some people will need to remain on anti-epileptic drugs for months to years. Key points. Neurocysticercosis is the most common cause of adult-onset seizures in the developing world and should be considered in all atypical first fits. Always take a full social history from a patient, including travel details, as this can provide vital information regarding exposure to environmental and infectious diseases.